The lung is responsible for controlling the external surface of the skin.
That's such
Isn't
a
that freaky?
mind bender.
I know, it does.
Hey Horse World, today's episode is a little different. After our episode with Dr. John Langlois on Traditional Chinese Veterinary Medicine, we invited you to send in your horse's story, and you did. So today, for the first time on Dear Horse World, we're following up with real-life case studies from you, our listeners. In this first of two parts, we explore a horse struggling with heat-induced asthma, a stallion with unexplained musculoskeletal pain, and a case of chronic coughing and intermittent itching. Dr. Langlois brings his decades of experience and a TCM lens to our studio for each and every one, helping us look beyond the symptoms and uncover what might really be going on beneath the surface.
Dear Horse World, it's Dr. John Langlois, and we're back at it.
John, welcome back.
Thank you. Happy to be here.
All right, we have some pretty cool questions that we received from the community when we did that call out in your last episode. So for everyone who's joining us and maybe didn't get a chance to listen to your first episode, do you want to introduce yourself and just give a little bit of a background before we dive into these questions?
Certainly. So I am an equine practitioner of 43 years. And I, 15 years ago, after my conventional medicine years, specializing a lot in reproductive and babies, I decided to venture out into studying traditional Chinese veterinary medicine. So I studied at the Qi University. In 2008, I began my education there and proceeded to take many, many different disciplines that they offer there, including herbal medicine, acupuncture, advanced acupuncture, Tuina, and food therapy. And in 2019, I finished my master's degree there, and I have been on faculty since 2021. And I'm assistant professor there.
So for everyone who isn't aware, Qi University is in Ocala, Florida.
In Reddick, Florida,
Florida.
Yeah, about halfway between Gainesville and Ocala.
Yeah, perfect. And it's a remarkable institution. We're very lucky in the horse world to have it.
Wonderful. And Dr. Shea, who is the master there and owner of the Qi University, has graduated over 11,000 trained veterinarians. So it's quite a good accomplishment.
Amazing. So in our first No Stupid Questions episode, we got through quite a lot of interesting content, and we did a call out at the end of the episode asking for the community to reach out, to send in an email with their particular cases, and that you would go through them live on the podcast. So we're going to do that. I'm really excited. Some of these look really interesting.
They do.
What was your initial impression when you had it scanned through?
I wanted to see the horse.
Like a true practitioner.
Right.
You're like, I want to get my hands on these horses.
Yes, I want to see the horse too. But sometimes that's not, I read some of them are for long distance from here. So
yeah. So we're going to do our best to help them out.
Certainly.
Okay, so let's dive in for our first email from Magdalena. Hi, I listened to your podcast for TCVM. I have a difficult case on my hands. My horse is 6 years old and has heat-induced asthma that appears in May until September, and then is dormant over the fall and winter. As soon as it gets over 18 degrees, he heaves yet does not have a heave line. He had extensive testing done at the equine hospital and was diagnosed with asthma via BAL. He does not cough much. He presents with heaving and elevated breath per minute. He can breathe up to 45 / 60 BPM at rest on warmer days. I have tried steroids and others, PRP, alpha-2, nebulization, various herbs, and we did Ayurvedic herbals for 1 year with no results. I can provide a lot more details if required. I would really appreciate your help. The horse is located in Toronto, Canada. So first of all, thanks, Magdalena, for sending in your case.
Yes, and it's very interesting. In fact, I have sites to visit Toronto. I've not been able to get there yet.
Okay.
And I thought it was quite interesting when I read that she was seeing her seasonality beginning in May, which is a little unusual. And I wonder if that's an effect of being a little bit, high
More
up
north.
and more north. And so, because we typically here would see it more coming in late summer, fall. That would be our season, but not all of them follow the rule books. But I thought it was interesting that she sees it happening in May, and then in the fall and summer is reasonably normal.
Yeah, and I think that's actually worth noting that as horse owners, and if we are looking at it through the TCVM lens, we're thinking about seasons, and seasons are changing. In some parts of the world, the spring, the fall, the summer, the winter, they might be expanding or decreasing. And I think that's going to inevitably affect our horses.
Absolutely. I've seen that being a resident here since 1969 in Florida. I've seen tremendous changes in the climate. And it does affect the horse, and it does affect some of their conditions for sure.
Interesting.
And just a note, in case the readers didn't appreciate, BAL is bronchoalveolar lavage. So what they do is they put a tube down into just beyond the bifurcation of the lung, and they take a sample out.
Oh, wow.
And they'll look at that under histology and culture to see what's going on. Is it an infectious process, or is it a response to allergens?
So actually, this is a good opportunity because I'm familiar with heaves, and heaves, for everyone who's listening who doesn't know, it's asthma, correct?
Correct.
So, and why do we call it heaves versus asthma?
Well, heaves kind of came about as a name because if you understand this disease, it is in the lung. It's very, very in the small airways. And it sets up almost like a one-way valve so that the air can come in reasonably well, but the air can't exit very well. So it has to use a little bit of an abdominal push. And when the abdominal push has been there for chronic some time, it establishes what's called the heave line.
So that's what she's referring to.
That's what she's referring to. Correct.
Which I've never heard of before.
Yes, so it is that little junction of the costochondral junction. You'll see a line formed there. And we find, too, in chronic cases that are pretty tough, they have to expend a lot of energy. So many of these horses have lost weight because of the extra energy they have to spend to get that air out.
Interesting.
Yeah, and that's a good way for us to diagnose it, is if that expiratory phase is longer than the inspiratory phase, then we can say that we're pretty sure we know what the disease is.
Okay. So what do you, I mean, you can't get your hands on this horse, unfortunately, at least yet. How would you approach this case?
Well, I would approach it basically the way I approach all of them, in a sense of, in TCVM, we want to be able to know what their pattern diagnosis is. It's not every horse the heave is treated the same. So we may find that there may be 3 or 4 underlying patterns that are going on in the horse that differentiates it from a different horse. So we're going to treat that one differently. And that's the beauty of being a trained practitioner, is that you can find out what that diagnosis is, and then treat them accordingly. So with heaves, there's pretty much 2 organs that are involved. One is going to be the lung, obviously. Some horses that have heaves cough a lot. Some horses hardly cough at all, as does this horse. She said she doesn't cough much. So, and that's okay. When we do have a cough, though, we recognize that as the energy of the lung is not going in the right direction. Okay, so it should go down and out. And when it's not going down and out, guess what it's doing? It's coming up. And that means coughing.
Oh, interesting.
So we want to reverse that, right? To send the energy of the lung downward.
Yeah.
And it's also important in TCVM to appreciate that the kidney works with the lung to pull that energy down. So when the kidney energy is not strong enough, the lung energy will be weakened as well. If we can get the kidney to be strong, it'll help pull the energy down, and the ability to breathe and do respiration is easier.
So this is because I think you've mentioned this before, organ pairing in TCVM.
That is the case. These 2 are paired a little differently. We have what we call husband and wife, and we have sister energies. These are not of that but
They're
they
not.
do coordinate their efforts together
Got it.
to try and make things work well. So we may find in a particular case that a horse has, when we do look at their pulse, their pulse is weak.
Mm.
And there are 6 different positions in the pulse, and one of them is the lung. And typically we'll find that that lung pulse is quite weak. And that can just help us to validate that the problem is in the lung. And if the qi is weak, we call that lung qi deficiency, meaning there's not enough energy in the context of the lung that's making it work properly.
Right.
There also can be situations where we have an imbalance in the yin and yang. Okay, that means they're either too hot or too cool. The yin energy is not strong enough, so they'll tend to be warm. So we can have a combination then. We have lung qi deficiency, the energy is deficient, and yin deficiency, meaning that the yin is not strong enough. So they'll tend to be warm. And then there's other things that can happen. We can have sometimes with the cough some fluid, and that's kind of a sign of dampness. We may also find that the kidney, when we're looking at the kidney, maybe they have some arthritis problems, which is run by the kidney, controls the bone.
Mm-hmm.
And so if the kidney qi is weak, we can have lung qi deficiency, weak lung, kidney qi deficiency, weak kidney. And there are specific herbals that would go along for what we find as our diagnosis. If we just diagnose lung qi deficiency, energy's weak, kidney qi deficiency, there's an herbal called Breathe Easier B. This is specifically designed to support the kidney energy and support the lung energy in tonifying them to get them to be enriched. So as we mentioned before, when we do our acupuncture, we kind of get the ball rolling, but the herbals finish it for us.
Right.
So we may keep them on that for a number of months, depending. It's not necessarily a life sentence. And, it depends also on how chronic it's been going on. If it's been going on a long time, we may have to stay with it a little bit longer in our work, in our medications, our herbs. If it's reasonably acute, then we'll usually can knock it out pretty quickly.
So this is a great opportunity because you have a background in veterinary medicine and and combined with your TCVM. I've seen lots of cases of heaves or asthma from a variety of, and a lot of them were attributed to exposure to mold in the hay. How does Chinese medicine or traditional Chinese medicine approach the concept of asthma from an immune system point of view?
Yeah, I mean, that's an excellent question. And TCVM doesn't necessarily use the word allergy, right? It's a Western term. No.
Oh.
No, we don't. We recognize it, again, as a pattern. We understand it from the Western perspective that some animals are sensitive to particular things in their environment, whether they are mold or whether they're, a variety of things, even grasses or foods they can be sensitive to. These may precipitate an allergic response. So, and interesting enough, TCVM, sometimes we treat a deficiency and an excess the same way. So we want to actually enhance their immune system, even though they say that in many cases the immune system is going a little bit too much. But in TCVM, we want to enhance or strengthen the immune system to combat this problem of being sensitive to the environment. We can take them out of the environment. We can move them to another location where they're not sensitive. Or those specific allergens are not there. But that's not usually a practical matter for a horse owner. They don't want to ship their horse somewhere else. They want to have it where they live. So TCVM recognizes and wants to be able to put it into a pattern of understanding. That's the key. So when you go to the hospital, you want a doctor to go ahead and give you a diagnosis. Well, that's what we have to do. We give them a diagnosis. Kidney qi deficiency, lung qi deficiency. Doesn't use the word allergens.
Yeah.
This is what's going on. And so we treat that, and we also enhance their immune function. One of the things that we recognize is the lung is responsible for controlling a very important part of the immune system called the wei qi. Wei qi is that energy that is very close to the surface that protects the body from all of those evil pathogens out there, whether they be wind or whether they be heat, cold, damp. All of those things are out there. Well, when the immune system and the surface is controlled by the lung, if that's strong, then the body stays in good harmony. When it's weak, then they get all kinds of issues. And you'll find a lot of times heavy horses, they have hives as well.
Really?
Yeah. And that's a weak lung system, right? Allowing the wind to come into the body, and it manifests as a hivey episode, little bumps around the skin that kind of move. They're windy. So they change from various places here and there.
Yeah.
So that's often common, but that's a reflection of the lung not being strong enough. And the immune system that the lung governs, the way, is weak.
It is really, this is an interesting case to then showcase the difference between Western and Eastern or TCVM's approach on what is going on or a problem. So, and this really, to me, emphasizes the concept of balance.
Correct.
Right? So she talks about how this horse has had nebulization, tried steroids. So these are all suppressants. These are all taking basically the approach that the immune system is overacting and not working as it should. So we're going to suppress it.
Right. Which
is the opposite approach that TCVM takes, basically.
Correct. We want to, that word balance can't be underestimated. That's what it's about. If you put the horse in balance, the horse can do awful much for itself. It really can. And we don't treat an overactive immune system per se. Right. We create the balance for the animal, and then they'll do the work.
So what are some takeaways from Magdalena?
Well, as a TCVM practitioner, I'm going to approach it that certain way. I don't know what she has available to her that she could, but I would urge her to reach out to someone that would be available that could guide her in getting the proper diagnosis, and then the proper, either whether the acupuncture was available, it's wonderful, and the herbal medicine is going to be very, very important. But that herbal medicine, and I try to emphasize, these are very powerful medicines, and they need to be given in an appropriate dose and for the appropriate condition. So it's not easy to cookbook, okay, well, give them this herb. I don't ever do that. I need to know what that horse needs to put it in balance. Yeah.
So urging everyone who's listening to go onto the CHI website, find a practitioner close to you.
Correct.
And then get an accurate diagnosis, to not just purchase herbs off the website without getting a proper prescription.
Correct.
Great. Okay. The second question is from Alexis, and this one's a bit of a longer one. So we really appreciate the background she's given here. So Alexis says, I've been listening to your Dear Horse World podcast and have become a huge fan. Thanks, Alexis. That's awesome. I listened to the one about TCVM with Dr. Langlois and heard at the end you were looking for interesting cases. I'm a veterinarian myself, and my own horse has been the most difficult musculoskeletal pain mystery I've ever come across. I have an ISH stallion that had to have a tooth pulled as a young horse. Long story short, it led to a lot of pain in his mouth, shifting teeth, TMJ arthritis, and a slew of body issues. My theory is the extraction led to teeth shifting and pain. As the teeth shifted, they pulled on the fascia of his body. When you work on him, you feel a twist in his body osteopathically. The altered jaw biomechanics led to the TMJ arthritis. He had the extraction the spring he turned 6. He'd been lightly started jumping tiny courses. He had a few weeks off, then was put back into work and started working with a pro that fall in Wellington. I kept him at home and hauled down 2 to 4 times a month for the trainer to jump him. He was very athletic but funny in the mouth in a way I'd never felt on a horse. Couldn't put my finger on it. Training progressed. He was very keen on the jumps, but was hard to balance on the other side. The trainer attributed to him being a stallion and hard in the mouth. As the jumps got bigger, the horse was doing better and better as far as ribbons and technique, but he was always funny difficult in the mouth, twisting his head, heavy on the forehand. He was better bitless, but the long-shanked hackamore the trainer wanted to use put a lot of pull pressure and didn't help the rebalance. This is so interesting. We tried various bits. He seemed happiest in a leather snaffle for jumping, and I rode him in a side pull at home. But I was never able to shake the feeling there was something wrong in his head. He got to the meter 20 classes at shows and started winning a lot. However, I saw changes in his body that I couldn't pinpoint the cause. Front feet growing out unbalanced, high on the lateral sides. His chest was getting contracted and tight, asymmetry of some of the muscles on his skull, a sore spot in one particular area on his back. Then he started having random rails or stops that were very uncharacteristic. Eventually, he got a little spooky. Throughout all of this, we radiographed his neck, his back, all four ultrasounded all four distal limbs and stifles, regular acupuncture, chiropractic massage, myofascial release, PEMF blanket, surefoot pads, osteopath, etc. I could not get this horse right in his face and in his poll. I pulled him completely out of work and sent him for a skull and neck CT. They found bilateral TMJ arthritis. He was only 9 years old. He was injected and left alone for a bit. Then I started with groundwork. He improved and I started him back under saddle and light jumping. Kept up with all his body work and TMJ injections, but he still wasn't 100%. I moved to Kentucky and he got a lot worse. I finally connected with a trainer that specializes in classical dressage and correct biomechanics, an osteopath, an animal communicator, and a neuromuscular dentist. He's shown the most improvement after his incisors were balanced. I still have a way to go, but I am hoping if I can ease the pain in his body, he can work to unwind him from his jaw, the origin of it all. He's currently too uncomfortable to do even in hand work, but is getting brighter and happier and more interactive again. I recently connected with someone with a young horse with almost the same exact history and symptoms to a T, which led me to my theory of jaw pain and moving teeth pulling and twisting his fascia. Thought you'd find this case interesting. Thank you, Alexis. I really appreciate all the detail that you went in there.
Yeah, it's quite a fascinating case. And, you know, I studied spinal manipulation, which is the term we use for animals, as opposed to chiropractic, which is supposedly a term for humans.
Yeah.
Doctors of chiropractic medicine, but nonetheless.
Yeah.
I taught that for 5 years at the Chi University, so I have a pretty good feel for how that TMJ is linked to a good part of the body, particularly the cervicals and upper cervicals. So it's a very, very important structure. And when it's not right, the horse is not right. And just to say, and she has been through an awful lot and tried to get to the root of the problem, and then also the secondary problems that occur from it. Yeah, and I'll just share too. I remember a case a number of years ago. It was a young horse, yearling. No, he was 2 years old. He developed a swelling over his TMJ.
Oh.
And it was visible. And within a few days, he hardly could walk, meaning he had no balance. He was walking cattywampus to the side. His jaw was going back and forth because from the pain of it. But what I was trying to emphasize is the idea that when that TMJ is inflamed or has problems, it's such an important structure. And I said this horse didn't function well at all. He actually, over a long period of time, went well and actually raced successfully, but it was a big battle, and it did leave him with some arthritis. So I feel for the horse and the veterinary owner. Yeah.
Why don't we explain what the TMJ is for everyone who's listening who maybe isn't familiar or doesn't know where on the horse it is?
Okay, so the TMJ is kind of behind the eye, on the back side of the eye. If you look at the side of the eye, back of the eye, there's several bones that are there, and they kind of almost make a 7. That TMJ sits in the middle of that 7 at the top of it, and it is a joint.
Okay.
There are 2 compartments to it. There is a lower TMJ, which does a little bit of gliding. But the upper part of the TMJ is a joint that has actually cartilage, a ball and socket. So it's much, much more important for the overall function of the TMJ to control movement of the masseter, muscles of mastication, and it. I say when it's not right, it's the horse is not right.
For those of us who have seen or looked at or love an equine skeletal structure, so when you look at the horse's skull, right, the masseter underneath the lower jaw, the TMJ is right where the two meet.
Correct.
And so it's on this side or on the other side?
Well, it's bilateral.
Bilateral.
So it's on both sides of the horse.
Yeah, but is it inside the bone or on the outside of the bone? Like, is it closer to the fascia or is it?
It's more inside.
More
but it's
inside.
Right. It's a joint, and you can palpate a little crevice. If you come back behind the eye and go, I would say 4 inches or so, you can feel a little crevice. That is the external appreciation of the TMJ.
Wow.
And what I do when I'm evaluating it is I just kind of push my fingers over the lower aspect of the TMJ and motion palpate it and see, do I get a response? Okay, and if I get a response, oddly enough, it's usually, that's the hypermodal side. The problem is usually on the opposite side. So we have to make that assessment that TMJs, even though it's painful on this side, it's because it's the hypermodal side. The hypomotor side is where the problem is on the other side.
Got it.
Yeah.
So this case is a really interesting one because it does emphasize, I think, how a problem can snowball into this supporting, I think, reality, or at least we believe that the reality is that issues are not isolated, right? That horses are holistic, or that we must approach things holistically, that one thing, which can be happening on one end of the body, can in fact contribute or cause various problems across the entire body.
Certainly, and she mentions, the fascial planes, those are really, really important, and they all connect through the body. So if one area of fascial planes are not doing well, it's going to influence another area.
So what are some, for everyone who's listening, there's opportunity for us all to be educated here. What are some common, there's a problem with a horse's TMJ behavioral indications that you see?
Well, the TMJ, again, is linked to the upper cervicals, and it's also linked to the teeth. So oftentimes we have problems bidding. Okay, we're going to see that, obviously, if there's a TMJ not out of balance or arthritic. That's why I think the veterinarian was taking, well, we've got to try a number of different bits and see which one might work well. But I think that she mentions that's the root of the problem, which is important. And a lot of times I'll go ahead and examine a horse and I'll look at their incisors. And if the incisors are aligned, then I don't have a problem with the lower TMJ. That's in good order.
Oh, interesting.
And if they are, you'll find that one jaw is off to one side and one jaw is off to the other side. And that's an easy fix. It's not
There's
hard.
the imbalance.
Correct. And if the upper joint is involved, which is more serious because it controls more motion of the TMJ, then that has to be appreciated. So what I do the first thing whenever I'm evaluating a horse is, what do the teeth look like? If those teeth are in need of a dentist in any way, I don't even approach the horse until we get that imbalance. Teeth have to be right, because the teeth not right, the TMJ is not going to be right.
Well, and man, if I've learned anything in the last year, it's like, everybody, please do not bypass a good float.
Yeah.
Like, get your horse's teeth done, because the problems that arise from teeth in horses is mind-blowing.
They're huge. So when we'll do these examinations, and we have a number of things that we can do for these horses. Okay, yes, Western medicine does go ahead and use maybe a corticosteroid injection or other anti-inflammatory injections. Those can be helpful.
Yeah.
We're able to use, and one of the things that I do as a acupuncturist, TCVM practitioner, is I go, okay, where is the channel of energy that's coming through the TMJ? What is it? And that's where I put my efforts into. Okay, so we know that there's a number of channels that come from the lower part of the limb, come up and go through the TMJ. And so we want to make sure that those are addressed, because whenever we have pain in the body, that means we don't have good flow through that channel. So if we can implement flow through the channel, then we can have a good way of relieving the pain.
I remember when you first mentioned that to me in working on my horses, when you frame, when you look at pain that way, that it's like a blockage, or that energy is not able to flow through there, and that's why the pain is caused. It made a lot of sense to me that way.
Yeah.
Right. Before we wrap on this particular question, I think it actually would also be really cool to talk about so a TMJ is a joint that's attached to the jaw, and the movement and the integrity of the jaw in the horse.
Correct.
But a horse's jaw moves differently than ours.
Yes.
And again, I think this would be a cool opportunity, because remember when I learned that, their jaw, I mean, naturally it doesn't, but a lot of us, I don't think, if you don't think about it, oh, my horse's jaw actually moves in a completely different direction than a human jaw. So maybe let's touch on that.
Well, they have, you can see that when a horse chews, right? They have 3 different phases when they chew. Okay, so it's a downward, sliding across,
yeah,
and back. And so these 3 motions are important. And, the horse's teeth grows for just about its entire life. So if this motion is normal, then the normal grinding of the teeth will be symmetrical and in balance as well.
Yeah.
So yes, the horse has like a 3-phase chewing approach, whereas we're just chompers.
What would you recommend to Alexis in this sort of complicated, and I think a little bit more longer, like this has been going on for a while for her and her horse, unfortunately?
Well, first I'd give her huge kudos for what she's done already. I mean, she's really approached this in a way, getting the best experts that she can find from different disciplines to take a look, because I think that's an important thing, because 2 eyes, 4 eyes, 6 eyes, 8 eyes may be better than just the 2 eyes.
Yes, and barn blindness is a thing.
Yes, right. So I applaud her for her efforts to do. Again, I'd love to see the horse, and I was kind of getting excited because she said I would take the horse down a few hours to Wellington. Well, I'm thinking, you must be up near me, up here. But then she said she moved to Kentucky. But there's a lot of really good acupuncturists in Kentucky, and if she would want to reach out, I can give some names to her that I have found in the past that know their discipline.
Okay.
So and I say, well, we did acupuncture and it didn't work. I said, well, what did you do in that acupuncture?
And actually, what a wonderful thing to touch on here. So when you try something and people go, they'll try acupuncture or they'll try osteopathy, and they'll go, oh, it didn't work. So they'll write off the modality completely.
Correct.
Do you think that's the right course of action?
Well, I believe in, being I'm kind of an expert in what I do, right? And I believe that that's it. A lot of the students that come to me, I say, learn to be good at what you do. It's so important. And having someone that has a very good understanding of their profession, of their discipline, is hugely important. So I would say, if someone came in and did some acupuncture, put a few needles in, and it didn't work, well, where did they put the needles? Did they use any electricity for that? That's an important aspect of most approaches to acupuncture, is that the horse has a lot of muscle mass, and it's very difficult to get that stimulation from just putting a needle in. You have to move that needle, and the electric unit does that for you. So, and in giving consideration, I know I don't mean to judge anyone who does acupuncture, but the large intestine channel is used to be called the dental channel, right?
Really? Because
it comes right down from the foot and goes right through the jaw.
Oh, interesting.
And so that is going to be a very, very important part of balancing the energy in the large intestine channel, with the lung channel. So I don't want to get into too much of that, but I think acupuncture and herbal could be still a very, very strong thing for her to consider, focusing on the root of the problem. The root of the problem is that TMJ.
Yeah.
There are certain energy channels that move through that TMJ. If you get them moving, then you're going to have less pain, and then the whole cascade of things, there's going to be less.
And what a beautiful, again, like emphasis in this moment to, in this case, really commending Alexis for understanding the root of the problem.
Correct.
But we all, as horse owners or horse stewards, riders, horsemen, horsewomen, it's so important to be in like devotion to finding the root of the problem, not potentially a byproduct of the problem or a side effect of the problem. And that does really require us to be very investigative.
I agree, and it's hugely important, and I see it a lot of times with musculoskeletal conditions. Right, we go and we're kind of going along, and they're like, we grade those 1 to 5 in our evaluation, and we have 2 places that have a 4 and a 5, and then the few places have 2s and 3s. Right. Well, I don't bother with the 2s and 3s. I go after the 4 and 5 because these are secondary problems.
Right.
The root of the problem is here, is the 4 or 5. And it may be even more complicated than that, meaning that stagnation or pain in the body is actually getting referred from somewhere else.
Mm-hmm.
So yes, that finding the root of the problem is it. Otherwise, we're putting Band-Aids on.
And I'm going to also mention to everyone who's listening or watching this episode, and we're going to mention this, I think, a little bit later, or actually just now. I'm looking down and I'm seeing that it's the Attili, which will give me a chance to mention this. I really urge everyone who's listening or watching that if you feel like someone could help you, but they're a bit farther away geographically, I want to just name that. For me, I have tried very hard in my cases to create space and opportunity to drive my horses larger distances, to go to a really good practitioner versus someone who's local. And trust me, it's been very inconvenient, but it's also transformed my horses' lives and in turn educated me 10x more than I could if I had gone to a closer but potentially less accredited professional. And so really just inviting an opportunity for everyone who's listening or watching. If you see someone and you're like, oh, but they're like a 7-hour drive, but that could be one 7-hour drive. Like many of us in the horse world will drive 8 hours to go to a horse show. We'll go drive 8 hours to go to
pick up a horse, drop one off.
Exactly. So distance is subjective, right? And I would say that I have experienced firsthand that if you drive a long, that might be considered a long distance or an inconvenient distance to someone who is remarkable, it can literally change the course of your horse's life and your own education. So I just wanted to mention that to everybody.
Very good.
Okay, our third question is from Attili, who's in New Zealand. So thanks so much for sending us this question all the way from New Zealand. She says, hi, I just listened to the episode twice. It was so interesting. I would be keen to send in my horse's story if it would be considered. He has a number of niggly issues which have not been resolved by conventional vets. They have treated the neck, SI, and hocks with varying results. And listening to this episode, I now wonder if his chronic cough and intermittent itching might be related. I have been working with a myofascial release practitioner, but I think I need to take a wider perspective. I am in New Zealand, so I don't have access to TCVM professionals. Online, I found 2 vets who are qualified in acupuncture only, and both are long distance from me. I would love to hear Dr. Langlois' thoughts on this.
Yeah, so I'm available 2 weeks, and if I can come to you.
There you go. I tell you, put together a bunch of people. Yeah, who wouldn't? New Zealand's amazing.
Yes, I have actually been to New Zealand several times, but just to Auckland, so I have not really gotten a full taste of South and North.
I think you need to do a New Zealand tour.
I think so. In fact, there was One of my students the other day is moving to New Zealand, and I said, "Oh, good. Well, if you need more training, I'll come see you."
Perfect.
So you ask about the connection perhaps between a chronic cough and intermittent itching.
Mm.
Interesting. They can be related, and they may not be related, maybe indirectly, and they can be related directly, meaning that we talked a little bit ago about the importance of the lung function,
Right.
that the lung controls the surface of the skin.
Yeah, that's
Isn't
such a
that freaky?
mind bender.
I know, it does. But
Wait, say it again, just for everyone to really
right, the
listen.
lung is responsible for controlling the external surface of the skin. Okay, and remember the lung also works with the Wei Qi, which is your immune fraction that is just under the skin in almost like subtle energy fields that controls the ability to keep those external pathogens out. Now, wind is an external pathogen. When wind comes in, they can get what we say hives,
Mm-hmm.
but it can also generate heat.
Mm.
Okay, so the wind comes in and it sits there and it vibrates a bit and generates heat. The heat causes the itchiness.
Yes.
Okay, so most skin conditions that are itchy are warm, right?
Okay.
So what we have now is a breakdown of the ability of the lung to control that wind from coming in.
Oh, and actually, this is okay. I will add this. This is when I got into human traditional Chinese medicine. I came to Chinese medicine because I had adult acne, and I never had that before. And from a Chinese medicine perspective, they said, well, your skin is the largest so first of all, they were like, first of all, your skin is the largest organ in your body, so it's communicating to you. It's often the last line of defense for your body to say, hey, something's wrong. And from a Chinese medicine point of view, they see
line.
acne as heat,
Right.
excess heat. So as soon as they addressed the excess heat in my body, the acne cleared up. And I remember that really blowing my mind.
Yeah.
That instead, Western medicine wanted to put a whole bunch of chemicals on it, burn it with all sorts of different types of subtle chemicals in skincare,
Yeah.
and really address the surface of the skin rather than inside the body, what's causing this to come to the surface.
Correct. And so that was the direct association between the lung and an itchy skin. The indirect association would be more of a blood deficiency. That is the number one cause of itchy skin disease in the horse and the dog. So what do you mean by blood deficiency? Well, if you took a CBC, the red blood count would probably be normal.
Okay.
But what we see is a very dry tongue. Not enough blood, not enough fluid that's in the body, so that tongue is dry. So I'm going to strengthen the lungs function, okay, which is going to strengthen the immune function to keep out those, but I'm also going to look, do I need to nourish the blood in some way? And we have ways to do that in acupuncture. And again, the heart is responsible for controlling the blood as the liver is. So we want to address these things and enrich that blood. There's specific acupuncture points for that.
Yeah.
But again, that has to be part of the understanding of that pattern. So it could be a number of things. It takes a trained eye to say, oh, yes, your problem is that you have a blood deficiency, and that is causing the skin not to be able to be nourished properly, and therefore prone to invasion, prone to problems.
And this is, again, a beautiful emphasis of how they're all interconnected.
Yep.
The spider web of our bodies, the spider web of the horse's body.
Yeah.
So what would you recommend for Ottilie to do in this instance?
Just like we're probably going to recommend for every one of those that have asked a question is get a well-trained TCVM practitioner to help you to get your pattern diagnosis right.
Yeah.
And what is the nature of the cough? Okay, is that, again, not enough energy in the lung function?
Mm-hmm.
That can go on to producing asthma, even though it's just a cough, but that's still not there. We have to strengthen, again, the kidney to pull that energy down from make the energy of the lung descend where it should go.
Yeah.
And if it's not descending, it's coming up and it's manifesting as a cough.
Now, Can you do a TCVM appraisal remotely? Is that something that's possible?
We were talking about that earlier
Yeah.
today when we were looking at your horses, and I think it's definitely possible through the, possibilities of Zoom is one, and
FaceTime?
FaceTime is another. Because for me, I don't necessarily have to do an AccuScan and go through every one of the channels, which is difficult to do over the phone.
Mm-hmm.
But if I get a tongue and a pulse,
Yeah.
and a good history and a complaint, I can pretty well put it together. So yes, I think it's definitely possible to do that. Are you saying that's what I should do in the rest of my life or my next lifetime? I think it's a great thing to consider that, there's people that have a lot of gifts with Reiki and can do cases. They don't have to even see the animal.
Yes.
They just have to connect to them. I don't have that ability, but if I get a good tongue and I can, get a sense of what's going on, get a good look at the horse, make an assessment of the overall shen, the eyes, and that I can do an awful lot, at least get them further along.
Well, and I think this is also a good opportunity. I know I've learned this through you, is learn to be able to feel your horse's pulse. We as horse owners, horse stewards, it's helpful. It's really helpful for us to understand our horse's anatomy and understand where these things are and why they're important. But I remember it, like when you showed me how to like really listen or feel the pulse. It's a remarkable, because then you can take it, you can feel it every day, and then you start to feel a pattern. And so this is the empowerment piece that education plays such a high role in, is if we know more, we do better.
Absolutely. And we just graduated 140 veterinarians in the basic acupuncture class. And for the horse, they haven't mastered the pulse yet. They've just gotten started.
Right.
And I tell them the first 1,000 are the hardest.
Right.
Not to say that it's hard to do. It just takes an effort to be able to have somebody show you how to get the pulse and then to feel it, and to get a nice, strong, eventing horse or a thoroughbred going to the racetrack. You can feel these pulses pretty well. Or a baby. The babies are wonderful. Young ones, the yearlings, their energy is beautiful. So you can find it. And once you find what normal is, then you can find what abnormal is.
Yeah. And this is, again, as horse owners, as stewards of our own horses, I think the onus of us being able to know what's normal or baseline for our own horses, very different than being a practitioner and being able to distinguish all the different elements of horses that you feel throughout a day.
Yep.
Right?
Yep.
So that's the empower. And I think often in the horse world, we are disempowered that, oh, you don't know this, so don't bother, let me do it or whatever. But I think that now I'd like to challenge the horse world to say, like, I actually think there are things that we can learn individually and empower ourselves to get to know our horses physiologically, energetically better.
Yeah. And the tongue is really, really important. So, and the tongue is right there for you to observe. It's just a question of, what are you seeing?
Yes.
Are you seeing it pale? Is it got some lavender or purpleness to it? Is it dry? Is it swollen? Is it red? And there's various areas of the tongue that speak of the organs. Liver's on the side, heart's in the tip of the tongue. So if you got a red tip tongue, then maybe we have some heart issues going on. So lots can be learned there, and it doesn't take years and years of training. It just takes an intention to know it.
And books.
Correct.
There are great books out there.
Yeah, we even have laminated pictures of horses' mouth with 10 different colors, and just show you what, if you're seeing this tells us a lot of information.
Amazing. Well, we're wishing Ottilie best of luck, and to reach out to us, and to go onto the website, and to reach out
to a TCVM practitioner.
Yeah.
Yeah.
There's so much to dive into, so we've split this special into 2 parts. Make sure to come back next week for our listener stories and insights.